Okay, last topic. Let's talk about NPs and primary care physicians. First of all, I think Daniel's going to be mad at me about this one, but here is the state of the world primary care physicians per 100,000. Vermont is number one in terms of a ratio, but it differs by state by a factor of about 2. You can see the colors are shaded in that ratio. But I think Vermont's going down now, as you told me. That's right. Okay.
Yeah, it still fits.
That's where they started from. Yeah. Okay. Amazing. Okay, so there's big disparities, big differences in how many PCPs per capita there are in the States. And this is going to be related to nurse practitioners as well. So what I'm doing here is I took that picture that you just saw and sorted all the states from, into thirds. The states on the left have the fewest PCPs. The ones on the right have the most. I just grouped them strictly into groups of 3, okay? So I'm showing you in the magenta bar is the number of PCPs per 100,000 residents, and that's by design, lowest to highest. And then in the white bars, I'm showing what is the growth they've had in the percentage of NPs, the number of NPs, how fast did that grow? And it kind of is what we might expect. The areas on the right, it started with the most PCPs. They've had the lowest growth in their NP supply of 65%. The states on the left, but have the fewest primary care physicians, have had the biggest growth in their NP population, NP supply. So it seems like there's some kind of balancing or substituting going on, or just playing off of these 2 workforces. This is kind of a side note that's important to keep in mind whenever we talk about this, is the scope of practice and how that varies. And you're probably all familiar with this, but the green states have full authority for NPs. You don't need to have a supervisor or a sign-off or a prescription review and things like that. And the red have the most of those sorts of restrictions, and the yellow states are in between. So you might have thought that, in the literature, people tend to find that the states with the most restrictions, NPs aren't going there because you can't practice to the full extent as much. But at least in this picture, in the overall, it doesn't quite work out that way. You have high growth in the South, quite a lot of NPs. So despite the restrictions, you still have a big growth in the NP workforce. And I'll show a bit more of that. Okay, so one question was, what areas of healthcare are NPs working these days, and how is that changing? And I don't have a great answer to this from the survey, unfortunately. I wish I did, but they didn't ask these questions in a consistent way. But in some sense, this is one view of that by what your certification is. And the bulk of NPs are certified as a family or adult generalist. But there are more NPs with acute care certifications. That's the blue bar towards the bottom. Pediatrics is kind of the same, even falling. There's a lot of demand for psychiatric NPs. Psychiatrists are very hard to find. So more NPs are going to that area, but it wasn't 0 before. They just didn't ask the question before. So this is not a perfect trend, but in any case, it shows that there is some diversifying going on of NPs, probably filling out where there are gaps in the physician roles. This is now a view from the point of view of a setting. Where do the NPs work, not what is their certification. About 43% are in ambulatory care. That's not surprising. That's kind of what you're designed to. But 17%, and slightly growing, are in hospital settings, acute care settings. And then really you're spread across throughout the healthcare system. Surgery, urgent care on the right, some amount. With the picture of NP growth and physicians, you end up in the different states with just a huge variation in. This is the ratio of physicians to NPs. Okay, so way on the left, a lot of the West Coast states have the most physicians per NP, about 4 or 5 physicians for every NP. Hawaii is on the far extreme on the left there. And then as you go all the way to the right, you have that east, south, central region again, or all the 4 states with the fewest physicians per NP. In Mississippi, it's almost 1-to-1. It's almost the same number of NPs as physicians, which is astounding to me. So there's been a ton of growth, and you have almost parity with those workforces overall. So all the way varying by a factor of 5. Now I'm showing that as a scatter plot, which is really interesting. And here, just focusing on those who work in primary care. On the x-axis, as you go to the right, you have more NPs. As you go up, you have more physicians. And so if you think of these 4 quadrants, the top right is you have a lot of both. You have lots of everything. And that's New England. We have a lot of everything. Okay, Vermont, Massachusetts, Maine, wonderful. And we have high costs. Then on the bottom right, these are again, Mississippi, Tennessee, Kentucky, high NPs, low PCPs. Okay, it's a very, very NP heavy ratio. On the lower left, you have low of everything. What's amazing to me is this almost looks like the geography of the US. It like works out that way. It's completely random. And then on the upper left is the Northwest with high physician ratio and low NPs. Okay, so there's a lot of complex reasons behind why you might see these different pictures, but you just have a different provider mix providing care.